Let's discuss food substances, lipid and protein assignment. So for the part C, question 1, you have to identify the physical state at room temperature of the fat, which is solid, and you have to identify where it's usually found. So, and this part of the table must be your reference here, so that you know that it's usually found in animals for the oil. Then it gives you idea what you should write for the fat. Question B. So here you just have to write the sentence based on the table that you're given and also an example. So example here is done for the oil. You have to do it for the fat. So fat is a kind of lipid which is solid at room temperature and it is usually found in plants. So the second one is about the role of the lipids. So role of the lipids, first one is heat insulator. So heat insulator means does not allow heat to pass. For example, for an animal, it would mean that animal cannot pass its heat, its body heat to the outer world. So it can keep its heat to their own body and feel less cold. And this is how you can identify the importance of it. So it is stored under the skin to keep warm. You have to specify where exactly it is stored. And same for the next role here. For shock absorber or soft cushion, you have to identify where it is stored around internal organs, and then you identify the function. So to protect these organs against shock. Part D about protein. So examples of foods that are rich in protein: fish, egg, meat, and the rest of them. I think many of you could get it right. And for question 2A and B, I think many of you could get it right. However, some of you can write proteins are essential for growth for part A. Proteins really essential for growth, but in the case of Sandy, it's not really the use of protein because she needs the protein for the repair of her wounds or body tissue. But in case of Vicky, we identify that proteins are essential for growth, so this is why the protein is important for him. And for question 3, so it is about Kwashiorkor disease. So the spelling is important here. And for part B, you are asked about 2 common symptoms of the patient with this disease. Some of you have written insufficient protein as the symptom, but this is not the symptom. This is the reason of this disease. But you are asked about the symptom. So symptom is something that you can see in that person that will help you to identify the Kwashiorkor. So for example, if we look at a child with swollen abdomen and weak muscles, it can be seen that the patient is having Kwashiorkor. So these two must not be confused: reason of the disease and symptoms of the disease.